and welcome to the second webinar in our series, Person-Centred Care in Practice. My name is Anna Flynn and I work at the Australian Commission on Safety and Quality in Healthcare. Before we start, I would like to acknowledge the traditional owners of the lands on which we meet today. For me, that is Gadigal land, and pay my respect to elders past, present and emerging. I would also like to extend that acknowledgement and respect to any Aboriginal and Torres Strait Islander people joining us today. Just a quick recap for those that didn't catch the first webinar. Here at the Commission, we define person-centred care as being respectful of and responsive to the preferences, needs and values of patients, their families and the community. In the introduction to the last webinar, you may remember that we had a look at some of the key attributes of person-centred organisations and how they link to the criteria in the Partnering with Consumers standard. One of the areas today's presentation will touch on is how do we measure the impact of person-centred care? A measurement tool noted in the presentation today is the Commission's Australian Hospital Patient Experience Question Set, also known as ARPEX. This is a survey developed by the Commission based on the aspects of treatment and care that patients have told us are the most important to them. Links to find out more information about the ARPEX can be found as part of our suite of person-centred care resources on our website. And remember, you can join our network for more ideas about putting person-centred care in practice. I'll shortly introduce our presenters today, but first some housekeeping. After the presentation, there'll be a live Q&A. Please type your questions in the Q&A function. Also, at the end of the webinar today, you'll be sent a short survey and would really appreciate your feedback on today's event. So, without further ado, I'd like to introduce Vanya Simic, Pauline Brockett, Peter Smith and Anita Hodge, who will talk to us today about patient experience and consumer partnerships at John Faulkner Private Hospital. John Faulkner Private Hospital has developed a reputation as a leader in person-centred care through the development of a person-centred culture, strong leadership and distinctive model of consumer involvement. So Vanya, over to you.
Thanks, Anne, for that introduction, and thank you to the Commission for giving John Faulkner Private Hospital the opportunity to present on the work we have been doing around patient experience and more specifically our Consumer Partnerships program. I would like to begin with acknowledging the traditional custodians of the country where we meet, the Wurundjeri people of the Kulin Nation. We honour their ancestors, spirits and elders, past, present and emerging, and ask their permission for being in their country. We also pay our respects to all Indigenous people here today. Initially providing some context around Healthscope. So we are a private healthcare provider formed in 1985, having presence in every state and territory in Australia. With 39 hospitals, 19,000 employees and 80 to 100 consumer consultants nationwide. Healthscope is most certainly committed to providing exceptional clinical outcomes, transparent public reporting and positive patient feedback that leads the industry. A little bit about John Faulkner Private. So formerly known as Sacred Heart, we opened our doors in 1939. That's 84 years ago. So I think it's safe to say that we've stood the test of time. And as a hospital, we actually operated in obstetrics to begin with. We were privatised in the 1970s and purchased by Healthscope in 2006. We are a 186 bed facility located in Melbourne's northwest, offering an array of services like emergency medicine, intensive care, surgical, medical and oncology, just to name a few. We provide services to a culturally diverse population, many patients who are older and have chronic and complex conditions. Major redevelopments occurred in 2019 and we now have an upgraded critical care complex, a new 35-bed inpatient unit, a purpose-built day of surgery unit, a redeveloped emergency department, a new CSSD, additional operating theatres, a new main reception and staff car park. Our consumer consultants were actually involved in the design aspect of these works. A little bit about our overall journey to date, so the evolution. We received an exemplar award from the Commission in 2018 for our work and efforts in building and embedding a sustainable consumer consultant program at site level. I started in the role of QM in 2020 and made it my mission to really grow, nurture and expand on the great foundations we had put in place. We successfully completed the NSQHS accreditation in December 2021, and Standard 2 was really a standard that was recognised as well executed, and all of our action items were met. And I guess this really brings me to the topic in the heart of this presentation, and that is why consumers? I'm sure you heard the saying, nothing without us, nothing about us without us. The consumer voice shines through at all levels of healthcare, at the system level where government policy and strategic policy making occurs, at the service level where feedback is sought and consumer consultants advocate for best practice, and then at the direct care level where our nurses and doctors and administrative staff are really making a difference each and every day. We know that moving forward, we are all to expect short notice surveys, and as of July this year, all hospitals will have to shift their mindset from, we need to tick a box and get through accreditation to let's really focus on delivering quality care on a daily basis. And what does that look like? In terms of Standard 2, it means that we are all going to have to have a really robust and stable consumer consultant profile on site. And we're going to need to be able to evidence that the consumer voice is being heard, more so than ever. Involving our consumers in everyday business, continuing to capture feedback, good and bad, and partnering in organisational design and governance will also be really vital. A little bit about our patient experience journey. So we have made gains from the early days where we were using suggestion boxes and short cycle mail out surveys. So we moved to the electronic surveys in 2017, and more specifically were early adopters of the APEX survey in 2018. Ensuring that 76% of our discharge patients receive a survey at any given time. And this has really meant that to date, we have received 12,582 responses, allowing us at site level to really make impactful change. Our overall rating around treatment and care is high and very consistent. So looking at this graph over a 3-year period, you can see that it doesn't really fluctuate a lot month on month. Our Net Promoter Score is also very stable. Our key driver questions are something we really focus on. Understanding what matters to our patients. Were their views listened to? Did they feel cared for? And were they confident in the safety and treatment of care they received, most importantly? The next slide is really the heart of this whole presentation. It's our consumer consultants and their profiles. So the faces that you see here are of individuals who volunteer their time and who are genuinely interested in making a difference every day. Their work, input, involvement to improve safety and quality of care is very much appreciated. Our consumer consultants participate in decision-making, in risk management. They contribute to ideas for improvement. They discuss issues for resolution and communicate important information back to staff and to the executive leadership team as well. We currently have 6 consumer consultants, all with very diverse backgrounds and passions, all of whom have been past patients at John Faulkner Private Hospital. The volunteer companion role was incorporated into our governance structure in 2021, and Pauline would like to share not only her experience as a patient, but also the work she's been doing within her volunteer companion role.
I actually had a very long relationship with John Faulkner Hospital. I had my tonsils out there when I was about 4, shortly after the hospital was opened by the Sacred Heart nuns in 1939. I grew up quite close to the hospital and returned to the area in 2015. I regard myself as most fortunate to have attended emergency at John Faulkner in 2018. In the following 5 months as a patient, the life-saving care I received from referred specialists, nursing staff, attendants, radiologists, cleaning ladies and kitchen staff were pivotal to my emotional well-being and recovery. I always felt as though I was being cared for by an extended family. My own family's input and advocacy was also well responded to and respected. During my long stay, I noticed some people did not seem to have visitors, and on discharge asked if the hospital had volunteer visitors. This idea was eagerly taken up, and I became a volunteer companion, regularly visiting selected patients in a busy medical ward under the guidance of the nurse unit manager and the quality manager. Sensing the patient's wishes, my visits ranged from 5 minutes to sometimes 1 hour of conversation. On many occasions, I came away absolutely captivated by the wonderful stories so many old people had shared, especially those over 90. Their experiences and courage should be greatly valued. On one occasion, I learned how to artificially inseminate a cow from a farming gentleman. In addition to chatting, I was able to impart to the unit manager concerns patients may have expressed. Unfortunately, COVID interfered with my visits and they have not been able to be resumed. Meanwhile, I have, with other volunteers, attended training sessions, been included most respectfully in many committee meetings, had a role in accreditation preparations, reviewed new brochures and participated in 2 projects in which John Faulkner were involved. Being very aware of John Faulkner's dedication to quality care, I have on subsequent admissions been able to impart first-hand experience as a contemporary patient. From my personal point of view, the respect I receive and the pleasure of involvement make me feel I'm still able to contribute to society.
Thank you very much for that, Pauline. Now moving on to Peter. He is one of our consumer consultants also. He is a fierce advocate for disability and would also like to share his story and his work to date, and also the vision for the future in 2023. So what we're planning to work on this year.
I'm a person who lives with disability and have lived with this disability since I contracted polio when I was 10 months old. I always have been encouraged not to see myself as a disabled person, but as I have aged, my disabilities have become more significant in my life. I now have multiple disabilities, and this is stemmed from the post-polio syndrome. It doesn't stop my life. I'm studying for a PhD at Federation University, and the polio and post-polio have continued to devastate my motor muscles, and I potentially face a very bleak future as my motor muscles die off. I've been a patient of John Faulkner Hospital since 1992, having had many times as a patient of the hospital, even up to today as I fight cancer. I've been struck by the friendliness of staff at the hospital, what a great place it is, and how much I want to work there. People with disability are amongst the largest single disadvantaged group in the community, and yet I can't get into a toilet for disabled persons and safely use my bells. I can't visit friends in their own home because I can't get into their houses. I and many people with disability feel isolated by the discriminatory behaviours of members of the public. I also struggle to build an identity as a valued member of the Australian community. My aim as a consumer consultant is to work on the way that staff members of John Faulkner Private Hospital work with people with disability. When I came, there was very, very, very little facility for people with disability, and this is still the case, but I have seen from senior management an absolutely fantastic commitment to making the hospital a more inclusive and an accessible place. I'd like to encourage inclusive practices within the hospital by conducting a walkthrough of the hospital to highlight an areas of need, of urgent upgrade to ensure that people with disability find their hospital inclusive, accessible and equitable. Where safety concerns for the patients make the use of equipment not possible, then alternatives should be provided. My other objectives within the hospital are working with the hospital's professionals to work towards provision of adequate height toileting facilities for patients to use, to present more disability awareness sessions, to provide training in communicating with people with dementia and related illnesses, to design and implement aided language displays. Working with my fellow consumer advocates to produce aids to facilitate disability awareness. Working with my colleagues to produce a passport to the hospital that describes for each patient their needs, likes and dislikes to facilitate their stay in hospital. Thank you for listening to me. I'm open to questions. Thank you. Bye.
Thank you so much for that, Peter. That was great. The Aboriginal Health Mentorship Program is another area we have proudly incorporated into our governance structure in 2021. I've taken on the role of Site Aboriginal Liaison Officer and draw on the expertise of our local elder and mentor. While we don't have a large number of patients who identify, we are mindful that patient advocacy, education and support for patients and their families are vital aspects of one's admission. Having this role has improved the overall cultural competence of our healthcare workers and in turn has led to improved trust with our Indigenous cohort. One of the really important questions we need to ask ourselves is, how do we keep consumers engaged? It's really one thing to have a program in place, but it's more challenging to see it flourish and be sustainable and embedded year after year. The first thing we really need to understand is that there is no cookie cutter approach. You know, each individual consumer has their own communication style, their own likes, their own passions, their own dislikes. They like to know what meetings are taking place and when, that's for sure. So being organised in your approach is really important. Running a yearly consumer planning day at the start of the year, preferably, to really set the tone, expectation, goals for the year is useful. And exposing your consumers, as Pauline said, to as much training, opportunity and project work as possible. That will most certainly reap benefits. Some of the initiatives we have put in place post-consumer feedback have included disability awareness training for staff, a specific feedback form on food services and cleanliness. We've extended training to staff around use of care board, and that's been a real focal point. A service offering document in the oncology area and subscription to Koori Mail and a specific cultural sensitivity survey for our Indigenous patients. We also need to stop. We also need to stop and smell the roses, I guess, and celebrate the wins. So the things that go well. And there are a lot of things that go well, you know. So in July 2021, we received an overall patient satisfaction score of 90.8. And that was our highest ever record. So we celebrated for days, and it wasn't only with our clinical, non-clinical, administrative staff, it was also with our consumer consultant profile, as they had a lot to do with this success. Creating exceptional experiences happens when employees, patients, visiting medical officers all work together for the greater good. And I guess if I could leave you with one message, and that is that we are all the patient experience. So make sure every moment counts. Thank you so much for your time.
Hello, thank you very much there to Vanya and to Pauline and Peter who were in the presentation there today. I'd like to invite all of the panelists onto our live question and answer session. And I'll also introduce Anita Hodge from Healthscope, the National Patient Reported Experience and Outcomes Manager. So a bit of housekeeping before we start the live Q&A today. So if anyone has any questions, please put them in the question and answer function at the bottom. You won't be able to see each other's questions purely because there's a lot of you online today. There's quite a lot of questions in there. So we'll get to as many as we can, but apologies if we don't get through all of them today. So welcome to our panelists and thank you for that presentation. We've already got quite a few questions coming through for you. First question, I'm going to throw over to Anita, who we haven't had a chance to hear from yet. Anita, a question for you. Is there an overarching national Healthscope framework for consumer engagement, which John Faulkner Private Hospital adopt? And you might want to explain a little bit about how Healthscope oversees a few hospitals.
Yep. Yes, certainly there is an overarching framework for consumer consultant participation, and that's based around the fact that in Healthscope, as Vanya mentioned, we have 39 hospitals in every state and territory across the country, and often quality managers in hospitals are a standalone position, and so if it's very much about networking and supporting them. So we do have an overarching framework. From a consumer consultant point of view, we have networking meetings where consumer consultants can all Zoom in together across all of our hospitals. All of our 80 to 100 consumer consultants can network together. It's led by a consumer consultant, and we purposefully don't invite the quality managers to that. It's very much their voice and their free space to be able to talk about their experience. Our training is the foundations training for consumer consultants. That's run from a national point of view, and we have 4 modules to that, and that's run again via Zoom, and myself and a consumer consultant do that. And then the expectation is they go back to their local hospitals and learn the nuances of their unique relationship with their hospital. So there's no cookie cutter approach. This is very much a supportive framework. However, the primary relationship is always with the quality managers and the GMs at the hospital. We are there to support them and on hand to assist. And we also have a national committee where all of our quality managers and all consumer consultants can meet together and talk through whatever their concerns are and what their successes are and share our wins.
That's great. Thanks, Anita. And Vanya, this one is probably directed a bit more to you. It's a bit of a twofold question, but how are the consumer consultants identified and asked to be part of the program? And then is there any training provided on top of that?
Sure, thank you for that question. So for the first part of it, we have some who self-identify. So Pauline, through her story, shared that she was one who actually self-identified and, sort of put her hand up and noticed that there was a gap. And so from there, we went on and created the volunteer companion role. We also have some recommendations. So with Peter's role, it was actually a recommendation from the general manager. He actually tapped me on the shoulder and said, I think Peter would be fabulous. Please get in touch with him. It's a gap. We need a disability advocate. So I was, right on it. I, called him that day, I think, and he was in for an interview, the following day or the following week. We also have a question through the APEX survey. It's something that we can turn on and off, essentially, and it's a question that says something like, would you like to be a consumer consultant and be contacted by the QM? So I obviously review that on a daily basis, and from that, I generally have a list of 10 a week because there is a lot of interest to call. So I get on the phone and have a conversation with those that have ticked yes. I'm just trying to think what else. Sometimes it's also just about the nurse unit manager, suggesting someone to me. In the morning meeting at 9 o'clock, they might notice that a patient from the night before has generally been really engaged and interested in such a role. And it's also about being really present and active on the floor and on the ward and around the hospital. you know, you can't sort of be sitting in your office and expect people to, you know, to build this program. You need to actually be out there. You need to be, you know, talking to your nurse unit managers, talking to the nurses in charge on a daily basis to get a feel for, you know, the patients that are coming through that way. In terms of orientation or how, you know, consumers are inducted, so they all essentially are to complete hospital orientation like any new employee. And we've recently moved from like a face-to-face one-day session where you hear all sorts of speakers to more of a pre-recorded system where, you know, the director of nursing does a 4-minute spiel, the GM does a 4-minute spiel, I do a bit of a, you know, 5-minute spiel on what we do in quality. And that way they are orientated to the way that the hospital works. And then we have a meet and greet session that they attend in the boardroom, where they actually are given the opportunity to meet other new employees. So people that they'll be seeing and dealing with on the board. And this is actually a new initiative. So today is actually the first day that some of our consumers are doing that session, and then doing a bit of a meet and greet, because we've had 2 newly onboarded consumers recently. So.
Excellent. And is there any actual, well, actually, I'm going to hand over to the consumers here to hear some of their insights. So I'd be interested, maybe Pauline, we'll start with you, but how do you feel that you're made to feel part of the team as a consultant?
Well, we're included in many meetings and always feel very respected, and as though they want to hear what we have to say, and also feel that notice is taken of it. And we have consumer meetings when we get together and are able to discuss things amongst each other. Yeah, I think they're the main.
Peter, how do you feel that you're part of the team?
Very much like Pauline, and also by being welcomed in the hospital. When I came back from sick leave for the first committee meeting of this year, just about everybody smiled at me and said, "Oh, welcome back. We're really pleased to see you." And I felt like, oh wow, I've come home. And I've got to say that Anna and Pauline and my colleagues on the panel are absolutely fantastic, and they welcome me as a respected person on the committee. The fact that I manage the disability plan actually encourages me to be really active in getting things being done for disability. When I had my interview with the general manager, I suggested that we run a bulldozer through the whole hospital and just wipe it out. And he just laughed and said, "We can't do that." But it came very close to that. And yeah, but it's really sad. It really saddened me to see that when one time when I was in hospital after a procedure overnight, the nurse came to me one night and said, "Oh, why don't you go into the lounge room? We've got a new lounge room you can go into." And I said, "How do I get into it?" She said, "Oh, through the door." And I said, "But there's no room for me in the lounge room, and me in my chair." And she said, oh, we haven't thought about that. And that actually became a sort of message to me that I needed to try and change the attitudes of people towards disability.
That's great. Thank you. Thanks, Peter. We're getting a lot of heart icons while you're speaking, so I think certainly making me feel like people are enjoying your stories there. Based on what Pauline and Peter have said there, Vanya and Anita, I'm interested. How do you ensure, or how do you measure that that this feedback is actually effective? So a specific question is, do you conduct an evaluation of consultants to, hang on, sorry, that's the wrong question. How do you make sure that the input's not sort of tokenistic? And what's worked well for consumer representatives to make sure that they feel that their voice is heard?
One of the programs that we have is we make sure that there's always an evaluation piece with our consumer consultants. So we always check in with them, and we have a pro forma, just a framework at Healthscope, and the consumer consultants model it to their own way that they want to provide information. But it's very much once every 3 months, once every 6 months, the quality manager will do that check-in piece, the one-on-one of how do you feel we're actioning your requests, and do you feel a valued member of the team? What's been best for you in the past 3 months? What can we improve? And so there is that constant personal one-on-one evaluation, as well as obviously if there's anything in particular that goes into a quality action plan, a quality improvement plan. In our quality improvement system, which is an automated system across all of our hospitals, there is a section that has to be answered: is there a consumer consultant involved in this quality improvement project? And we monitor and measure that as an overarching measure of making sure that our hospitals are engaging their consumer consultants and in the right projects.
I'll just add to that, Anna. In terms of the voice being heard, I think a lot of the feedback comes through to me directly. So it's really about me being accessible, you know, whether that feedback's coming through via email or via a phone call. And I can get numerous calls a day just to kind of cross-check, you know, the calendar, is this meeting happening? Or, you know, I noticed this last time I came in, or just, you know, making the time to really genuinely listen. I think is really important. Another forum that we have is the Consumer Partnerships Committee, and that's where all of our consumers come together with our ELT, and that runs quarterly, and that's really the space, the safe space to really chat. We obviously have a set agenda, but there's a lot of time allocated to new business and things that we've noticed sort of for the last quarter. And then there's the Consumer Planning Day, which I mentioned in my presentation.
That's great. Peter wants to add something, I think, there. You're on mute, I think, but yeah.
Anymore. I'm not anymore. As both Vanya and Anita have indicated, measuring success is not always the best way. By surveys and things like that is not always the way to go. Having a cup of coffee and sitting and chatting with a consumer consultant can have a huge effect on what people think, and I just think that is really, really important.
Yeah, definitely. Anita.
Sorry, just one more thing to add. It's very much about valuing the relationships as much as the outcome. So you may start a project and not get the outcome that you've anticipated or that you wanted. However, the relationship of true respect and collaboration in working together to either get a positive outcome or to move in a different direction is very much within the QM and consumer consultant and all of the hospital teams' mantra. It's their culture of working together and valuing the relationship is also a measure. It's not just the outcome we measure, it's how did we get there, and did we get there well?
Excellent. And when I've been talking to you in creating this webinar today, it reminds me as well, Pauline, we were talking about how there are systems for people to make complaints through a health service, but sometimes when you're talking to people individually, you can pick up on some of those issues. And I think you mentioned sometimes, or there was an instance where a complaint was turned into someone actually then coming through your consumer consultation, your consumer program. Is that right?
Yes, well, I usually speak to the nurse in charge if there's something comes up, and then to Anna. And normally when I was able to go around the hospital until COVID, I have a form that I fill in after I've been to visit somebody and outline anything on that that I think needs attention.
Certainly, two of the best consumer consultants I've ever recruited and still work with to this day are consumer consultants that initially made an approach to the hospital with a complaint or a service suggestion. We worked through all of their concerns, and by the end of it, there was a relationship of trust, and they truly believed that we will listen to you and we want to make things better in whatever way we can. And so whenever I'm talking to new quality managers, that's certainly one thing that I do instill in them, is listen to your people when they're talking to you about service suggestions, complaints, whatever it may be, because they're the ones that you can build their trust and build that relationship, and they will be the most phenomenal consumer consultants because they took the time to sit down and tell you their story. They didn't have to. They could have gone to the media. They could have just complained to their family, and they didn't. They actually wanted to make things better by telling you.
Yeah, Peter.
That's very rare, Anita, as you probably well know. Most people who complain just don't go back to the place. Yeah. Sorry, I just lost my train of thought there for a minute.
That's we can come back to you, Peter.
Leave it there and come back to it when I need to.
Yeah, definitely. And Anita, or anyone that wants to answer this one, but are there processes in place if a consumer consultant talks to someone and has a bad experience whilst they're out talking to someone on the ward? Is there a support program for the consultants there?
Yes, certainly part of our training is about talking to patients and preparing our consumer consultants for if they do go into a situation where they feel uncomfortable. Very much is obviously the pre-preparation. So we would never expect a consumer consultant to go into a patient's room and do a care board audit or an interview with a patient or just a chat with a patient if they haven't checked with the nurse unit manager first that that's appropriate. But we do offer some de-escalation minimal techniques and some advice on that, and every one of our consumer consultants has the ability to tap into our EAP, our employee assistance program. So if they do find it overwhelming, if there is something that has upset them, they are always given that free confidential service, the same as every other one of our employees across Healthscope, to manage that. And also the networking forum that's where the consumers talk together and use those troubleshooting techniques that work for them and have worked for them for a number of years and mentor the newer consumer consultants coming through.
Peter.
I just remembered part of being a consumer consultant is forming a relationship with your colleagues. Pauline, I reached out to Pauline one day when I was having a bad experience, and she said, "Oh, that's horrible," and she now sends me photos quite frequently of her walks when she goes around Kew, and I just think that is so lovely, and Vanya is really approachable at any time, and she just says to me, Don't overload yourself, Peter. Keep on going. You've got a PhD to finish.
I'll just add that a lot of the time, there are a lot of these competing priorities. We have a lot of committee meetings, reviewing of brochures, a lot of emails that come through, just general documents to read for leisure. And then obviously all of our consumers have a life outside of this role as well. So I always stress, don't overload yourself. Take some time out, think about your mental health and filling your cup in that sense. So I'm just adding to what Peter said, that I'm constantly telling Peter just to kind of take a little break and touch base when ready.
Yes, Pauline.
I have been back in hospital since 2018, And I find as a consumer consultant, I kind of feel a responsibility to look after other consumers.
Yes.
And when
yes,
I notice
indeed,
things that
indeed.
I don't think.
Oh, Vanya, you've gone on mute.
And actions usually taken.
We just missed the last bit of what you said there, Pauline. Do you want to just tell us again? So you feel a responsibility to other consumers?
Yes, as a consumer consultant, I do feel a responsibility to other consumers. And when I notice things that I think could be improved or are not right, I take them back to Vanya in the hope that other people will benefit from the changes that may be made.
It's fantastic, and that leads into a question that's coming through a bit in the Q&A. In terms of, I know when I first looked at this program and it looks to be so well run, I thought there must be a massive team behind it. But Vanya or Anita, I wonder if you could explain sort of how it's resourced and how many people are actually involved in running the program.
I can take that question. So it's literally a portfolio that sits within my role of quality and risk manager for the site. It's obviously a very big passion of mine. So I tend to, allocate any spare minute to it. And I, generally on a weekly basis, I'll put in slots here and there of time to dedicate. It is tricky. I would be lying if I said that it wasn't, because you are juggling a lot of balls. I'm sure there are a lot of QMs on this call, and it's about, I guess, prioritizing to the best of your ability and working within your means, and just kind of juggling from week to week, really. But it's part of the role. It just sort of sits in my portfolio. I don't know if Anita wanted to add anything from corporate.
No, I think that is the norm, is that it's just a quality manager at a hospital. Sometimes there'll be a quality auditor assistant or a quality officer that may assist on a part-time basis, but most often it is just a quality manager in our hospitals. And I think that there was a question in the chat about being tokenistic, and I think this is absolutely a proof of you cannot have a tokenistic consumer consultant program. It has to be real. And if you make it real and you make it valuable and have positive outcomes for everybody involved, then it can never be tokenistic. It may start as tokenistic. It may start as a ticker box exercise to pass accreditation or to appease whatever requirement. But once you actually start the process, if you truly believe in it and build the relationships, it's anything but tokenistic, and it's not a chore. This is actually one of the nicest parts of our job as a quality manager. We have lots of difficult jobs to do. We have clinical incidents to manage, but this is absolutely the pleasure of quality management, is the engagement and co-design with our patients and our consumer consultants in all areas, whether it be mental health, independent services in our clients that are in our independent livings, whether they're patients in hospital and are not just in consumer consultant roles, but actually our day-to-day bottoms in the bed patients in the hospital. It's very much recognizing everybody's role, and it's never tokenistic if you truly believe what you're doing.
Yeah, and I know Peter and Pauline, you're volunteers in the work that you do, but I understand that there are certain rewards that come with the role as well. Do you want to talk a little bit about some of that?
Yeah, I do. I was just going to put my hand up to say I want to say something. I find that getting out of the house, I have agoraphobia, which is a fear of going out. And I find that going into the hospital and doing the walk around one of the wards is a really good way of me dealing with my agoraphobia. So I believe that when you've got a condition, you need to face up to it and take responsibility for it. And that's what I try to do. and as much as you can. And I just think that that's really important.
That's great. And Vanya, I know there's other ways that you that you sort of rewards probably the wrong word, but how you remunerate the volunteers in terms of morning teas.
Yeah, there are definitely morning teas. There's obviously coffee every time, you know, I see them. We generally sit and have a cuppa first. There's obviously free staff car parking for all of our volunteers as well. Is there anything else that comes to mind, Pauline, that you've noticed over the years that we've done?
Well, just being included in so many things like committee meetings and projects, they really make one feel valuable. For me personally, it's a wonderful way of feeling still contributing to society, and the reward is when visiting, leaving people looking as though they're a little bit more contented and happy, and feeling that I am contributing to the policies of John Faulkner, their attention to quality.
Anita?
Experiences across other hospitals are very similar. Overwhelmingly, most of our consumer consultants are volunteers. We speak to the consumer consultants at the beginning of the recruitment process, and we talk through expectations. And I think both Peter and Pauline have spoken previously about they want their role to be voluntary, but very much what Vanya and Peter and Pauline have mentioned happens across most of our hospitals, in that they're morning teas, dinners, they're invited to staff celebrations, so staff Christmas party. If our hospital has an ED department, then the excess will be waived if one of our consumer consultants visits an ED department. Gift cards, patient experience week, we may give a gift card, or Mother's Day, we may give a gift card, Father's Day, whatever's appropriate to that particular consumer consultant. There have been occasions where a consumer consultant said, no, I don't want to, and we've made a charitable donation on their behalf to the charity of their request. So there are a number of ways, though not employing our consumer consultants, that we show appreciation and value their time, and very much respect that their time is given to us voluntarily.
Great. And you may have covered this in your presentation, Vanya, but do you conduct an evaluation of the consumer consultants and seek feedback on sort of their satisfaction, level of involvement and level of influence that they feel they're having?
We do. We sort of run at the end of the year. I'm not sure what the actual term of it is, but it's more or less like a one-on-one, you know, share the year type thing with me. And there's specific prompts of what went well, what were the challenges, what are the aspirations for next year, like, you know, what are the projects that we want to be working on, etc. So we do go through that process, and it's generally towards the end of each year. The likes of one of our consumers who's been with us for about 8 years, or actually 2 out of the 6 have been with us for a long time. So they've gone through this sort of over and over. Obviously, it's a better process now, but there's been lots of things that they've seen over the years, and lots of things that they've contributed to just by being around for, you know, eight or so years. So that's really exciting. Yeah.
You mentioned to me when we were preparing for this as well, I think Pauline mentioned that their photos are on the wall as well as part of the team, which I think is a great little initiative to make them feel included and part of the team.
And you very often find people that you don't know saying hello to you, and it's because they come to know you from the photos that are around the hospital.
And it can be quite embarrassing.
When you don't know who they are.
Why are you getting acknowledged by first name and I'm not?
Well, Peter, actually, there's a question directly for you. Do you have any tips for other people with a disability who want to make change in hospitals or become a consumer consultant?
That's a good question. I would say, from my perspective, have a go, but don't put all of yourself into the process of being a consumer consultant. Have balance in your life, and if things go wrong, I'm always a person that speaks out and says this is wrong, and it drives my family absolutely mad. And I've learned over the years that you catch more flies with honey than you do with vinegar. So yeah, and I would encourage anybody that wants to be a consumer consultant to get in there and have a go and get your hands dirty. And when things don't meet your needs and meetings are scheduled at wrong times and you've got to forego a shower or something like that, speak out and say to people, this is not meeting my needs. Most people in the community have really good feelings about people with disability, but they don't have the knowledge. And this is what I've found, and Vanya will back me up in this. When we talk to staff about how many people with disability do we have in the hospital, and they get really surprised at what can happen.
I'll just add that Peter has run a couple of disability awareness training sessions for our staff, and those sessions have been invaluable because the staff that sit in that room, they're just, some of the statistics and the way that Peter presents and shares this information, it's really eye-opening because a lot of our staff aren't actually aware that this is the experience. This is actually what it's like. These are the numbers.
Well, people with disability are amongst probably the largest minority group in the world. There's about 1 billion people around the world who have a disability in some form. So they're a big voice in our community, and we're very lucky to have an organisation that's willing to allow me to do these things.
Anita?
Yeah, just to expand on a point that Peter and Vanya have both made, you can expand outside of the disability and those training sessions from our consumer consultants or ex-patients that aren't actually on the consumer consultant program, but that is absolutely invaluable. So even in the maternity space, if you've had a mother who's had a baby that's ended up in special care nursery and her experience, if she can come in and talk to the staff, that's happened a number of times, and that is absolute valuable insight into the life and the feelings and the emotions that happen from a patient voice and a patient through a patient lens when the staff obviously haven't been in that situation. Also, again, a patient who made a complaint in one of our hospitals about she heard the nurses talking about her outside of the room, and she was invited into one of our hospitals and had that discussion with the nurses and with that team of how it made her feel, and just come in and don't talk about me outside the room, involve me, I'm here, I'm a person. So those golden opportunities for any consumer or patient, whether they're on a consumer consultant program or not, to speak to staff is absolute gold. To give that patient lens and that patient voice, and as a quality manager and people in charge of patient experience and consumer consultants at your hospital, look for those opportunities every time.
And do you also include consumers wider than on the ward and some of the areas you've highlighted in areas such as research or any co-design projects that are going on more broadly?
Yes, certainly. In research, we had a consumer consultant involved in, we did a patient reported outcome measures research 18 months ago, and there was a consumer consultant sat on that research panel. He's published. He's also now involved with the university on a full-time basis and sits on other consumer consultant on other research projects. So it's really important to involve them at every step of the way, when not just formal research like that, but even if you're trialing something, if you're trialing a patient journey mapping project, for example, include your patients from beginning to end, the same voice, the same lens.
That first example sounds like a whole new webinar. You give me a new idea. Okay, and the last question, I'm interested in the answer to this one myself, actually. How do you ensure the privacy of the patients when consultants are engaging them on the ward? Is there any difference to a nurse talking to a patient, or is it exactly the same sort of procedure? Oh, Peter wants to answer that one.
I signed my life away when I joined up with Healthscope, and I was told if I broke confidentiality, that was it, or I'm out of there. So I'm scared witless of breaking confidentiality. No, really, I think we're treated as equals with the staff, and there have been occasions where I've heard back about people who are working as students at our hospital, and they've broken confidentiality, and I reported that to the director of nursing, and that poor student got into a hell of a lot of trouble. So privacy is like gold, because if you don't look after people's privacy, and it breaks the trust that can be built up between a staff member and a patient. And people often think, if you're talking about me like that, talking about this person like that, what are you talking about? What are you saying about me?
It's a very important piece in the recruitment process, is that discussion around the confidentiality requirements. It's part of our foundations training, and an overall code of conduct, as we all have to adhere to a code of conduct, is part of our consumer recruitment pack, our onboarding pack, and the expectations are set very early on in the piece, and that's part of that relationship building before you actually say, yes, we'd love you to take part of our in our program. It's highly respected, the patient privacy piece, and obviously Peter and Pauline can talk to it incredibly well, as can every one of our other consumer consultants, because we've all had those conversations and signed the confidentiality and code of conduct agreements.
Mm.
Fantastic. Well, look, we're reaching the end of our time here, and I'm conscious that there were many questions we didn't get to. Many of those questions, I think, have also given me more ideas for webinars, particularly around how do you include a diverse range of consumers, especially when people are time poor. So I think that there's a whole separate session on that. I did want to just ask Vanya, you're the one that's been leading this program, and you've done clearly done an amazing job. I can tell by the passion that Peter and Pauline have for their roles. Is there anything else that you would like to add before we finish today?
Take a bit at a time. I think this is something you can't really build overnight. I think this is something that you really need to nurture, and like a flower, you need to water it daily. So if you can just do little bits every day, whether it means on a Monday, you're on the floor, you're talking, you're having a bit of a look. On a Friday, you're making calls. You know, if that's where you start with this, great. And then the sustainability aspect of it is, you know, I guess another thing altogether. You have to kind of have the passion and the drive, and kind of just stick with it, I think, to see it flourish overall.
That's great. Well, thank you so much to John Faulkner Private Hospital, Vanya, and Healthscope, Anita. Peter and Pauline, thank you so much for your consumer insights as always. It makes the key difference when we're able to involve you in this discussion as well. So thank you all very much. This will be recorded and available on YouTube if anybody wants to watch it again. And if anyone would like to join our person-centered care network, you can tick the box in the email. You'll receive a survey after this, and we'll keep you updated with news. And if anyone else has any case studies like this they'd like to share, please get in touch. Thank you all very much.